Back in 2019, AI started being used to help doctors diagnose, treat, and prevent better. 6 years later, those same models have evolved beyond human ethics and can predict death with about 80% accuracy. Stay with me, because these algorithms exist. They are being tested right now, and you must know about it. Because soon someone will use these to deny you insurance, a job, even healthcare. AI will decide if you are too expensive or not worthy to be treated. If you follow this channel, you know I do not do clickbait or call for alarm without reason. All I do is based on first-hand professional experience and research. So, let's start with the first model that was trained for this task. It was 2019. DeepMind and Google Health trained a model on thousands of medical records and lab results. It was for good reason. It learned to predict acute kidney injury 48 hours before it happened. Fast forward to 2024. Stanford, the NHS, and the US Veterans Affairs System started using evolved versions of those models for something far less ethical, to calculate the probability of a patient dying in days, months, or years. They didn't call it a death prediction machine, but that's exactly what it was. Today, there are 2 AI models that stand out for their accuracy in predicting death. One is called Life2Vec. It was trained on 6 million Danish lives, and it can predict death within a 4-year window with roughly 78% accuracy. The second is called TRisk. It came out of Oxford and King's College. It predicts 3-year mortality in heart failure patients with a C-index of 0.845, meaning it was right 84.5% of the time. It is currently outperforming every traditional clinical system. This is where it gets personal and, in my opinion, unethical. And it's unethical mostly because it works. And once a model can forecast who's most likely to die, it becomes valuable. Let's be brutally honest. Predicting death is money. Life insurance companies already use predictive analytics to price policies. They are quietly testing AI systems trained on health records, credit scores, and our wearable data. We have a risk score before a human ever reviews our file. Even more scary, it will be used to determine employment. Companies are already using biometric data and hospital records to flag high-risk workers. Imagine you're up for your final interview, and an internal algorithm decides you're a long-term liability because of an illness you may not even be aware of. Governments, too, have reason to care. Predictive health AI could reduce healthcare costs, plan resource allocation, or prioritize organ transplants. But once you can label citizens by predicted lifespan, you've built an invisible caste system where data defines destiny. Also consider that these predictions are a black box. They are shielded by hospital firewalls and insurance algorithms. In other words, they don't need your consent. Question to you: what do you think happens when AI knows your death date before you do? Would you even want to know? Some hospitals use death prediction AIs to trigger end-of-life planning conversations, telling families sooner that time is running out. It sounds compassionate, but what if it's wrong? Or even more mind-bending, what if the act of predicting it changes the outcome? That's the paradox. The more precisely we predict the future, the easier it becomes to shape it. A self-fulfilling prophecy written in code. If we look at it this way, the prediction doesn't just describe your future. It literally defines it. The technology is already here. The question is who gets access and who gets left at its mercy. Because somewhere, right now, an algorithm might already have your number. Not out of malice, just math. But in a world where math becomes policy, that's enough to change everything. So the next time you hear that AI can save lives, remember, it also knows when lives will end. And the scariest part isn't that it knows. It's who gets to see it. This is AGI Insider, as always bringing the latest in AI without bias and full transparency. Thank you for taking this journey with me. Please leave your thoughts below.